Hi everyone, Dr. Gary Linkov here from City Facial Plastics. Today we're going to be talking about Botox. Botox can be priced either by the unit or by the area of the face that's being treated. In my practice, I like to charge by area because I feel like that's a more honest way to deliver care. I see patients 2 weeks after the initial treatment, and if I feel that more is needed or adjustments need to be made, then we do that at that time. Botox typically starts to work approximately 3 days after the treatment. It will then last for up to 3 months. You can exercise after Botox. There are many restrictions that some physicians and other providers will place on their patients after Botox treatment, but I personally found that when you do a literature search and you go through all of the data, there's no reason to put these restrictions on patients, and most activities are absolutely fine right after your treatment. Botox can be injected around the eye, so I like injecting at the side of the eye and not underneath or right above. Botox can be used for the forehead, for the glabella or the 11s, as well as the crow's feet. There are other indications for Botox. Sometimes bunny lines can be addressed. Sometimes if you have a down-turning sides of your mouth, there are muscles here that can control that, and if you stun those muscles with the Botox, that can help turn the frown upside down. So after a treatment with Botox, I do not place any specific restrictions on my patients. I would recommend avoiding alcohol for 24 hours and any medications that might thin the blood. Otherwise, you can go about your regular activities. So in terms of side effects of Botox, one potential problem is paralyzing the muscles next to the area that you're injecting, and that can generally be avoided by picking the right provider for you who has plenty of experience with these injections and who can do it safely. So candidates for Botox are individuals who have lots of lines that form on their face when they're animating. So if you have lines that are there at rest, Botox may or may not help. The best candidates are those patients who have lines that are forming as you're making different types of faces, and if you want to prevent those lines from getting etched in more permanently, those are good candidates for Botox. Botox and other neuromodulators should not be injected in pregnant women. They have not been studied in that fashion, and therefore it is best to completely avoid Botox and other neuromodulators when you're pregnant or even breastfeeding. Sometimes when patients get injections by the forehead area with Botox, there will be a headache for usually 1 to 2 days. That will always go away, and that is usually due to the muscle starting to get weaker as the Botox is taking some effect and can create some headaches that will resolve. I hope you've enjoyed that Q&A on Botox. If you'd like to see me in my practice, City Facial Plastics on 60th and Madison, please call the number below. Thank you.